Hi everybody, I'm Mark Miller with Health Strategies and I'm your Value-Based Payments Educator. Thank you for watching this video on achieving value-based payments, a sequential approach to risk versus reward. Hey, are you frustrated that you're not receiving enough additional payments on your value-based contracts? And are you so busy with your own responsibilities that you're having difficulty really getting to the bottom of what the problem is? Well, I have an alternative for you, and it's called the educator model, and we'll talk a little bit more about that at the end of this video. But let's begin with the video, Achieving Value-Based Payments, a Sequential Approach to Risk versus Reward. So let's begin by identifying the two major types of models or level of models that you experience in value-based payments. Level 1 is the fee-for-service contracts that offer you additional value-based payments on top of your fee-for-service payments. And level 2, on the other hand, are these advanced payment models within the licensing of the accountable care organization or the clinically integrated network. So there's about 1,500 ACOs, CINs, half of them are ACOs, half of them are CINs, and there's a lot of opportunity within these level 2 contracts that will help you gain additional payments. Now you'll notice in this video what I'm not addressing the level 1 fee-for-service additional payments that you might receive through the QPP program, CMS's Quality Payment Program, or through the Merit-Based Incentive Program known as MIPS. These types of additional programs deserve their own independent video. There are other resources that you can go to get help with that. Okay, so some examples of level 1 contracts are commercial contracts, large self-insured employer, and Medicare Advantage value-based payment contracts. Some examples would be Blue Cross Blue Shield's QCPI, that stands for Quality Care Partnership Initiative. The PCMH, which is the Patient Centered Medical Home, Blue Cross has renamed that now to Medical Home Partnership, or MHP. Another example is Humana's MPPQR model. This is the Model Practice Physician Quality Recognition Program, and of course the other BUCAs, otherwise known as United, Aetna, Cigna, Amerigroup, and these type of folks. They also have their own level 1 payment programs, but some of these really depend on the size of your practice and how your practice is structured. Okay, so let's go on to level 2. Level 2 value-based payment examples would be, for instance, large self-insured employers, Medicare Advantage, and Medicare Standard and Medicaid. So in my opinion, in terms of the sequence, which is the purpose of this video, I would start with the lowest risk model of the large self-insured employer value-based model. You'll have to collaborate with the third-party administrator of the health plan and the broker consultant of the employer's health plan as well. So in this employer model, the employer's prior health plan costs are what you use to set the baseline from which you can work with the collaborative partners to save money and to share savings as you improve the quality of health care for the employees or the health plan members and beneficiaries. There's very little downside risk in this type of model, which is why I recommend that you begin with this model. And of course, the communication plan as you move forward with this model, it does coincide with the health plan's enrollment period. The second type of model, which is a clinically integrated network model, is the Medicare Advantage model. I would describe this model as more of a medium to high risk model. These Medicare Advantage value-based reimbursement models generally include both shared savings payments as well as quality initiative payments. The quality initiative payments paid generally on a quarterly basis, the shared savings on an annual basis. Now this program does involve commercial payers who serve sort of like a surrogate for CMS. That would be Blue Cross Blue Shield, United, Aetna, Cigna, and all of the BUCAs. The third type of model, which is an ACO model, is the standard Medicare or standard Medicaid. Now I would describe these models as high risk. So I would not recommend you participate in these models from the start. Get your feet wet and get some experience in the other models before you dive into these models. Some examples of this models, for instance, would be hospital pay for performance, That would include hospital-based purchasing, group purchasing organizations. Readmissions reductions would be another payment, but remember that this is a penalty avoidance payment. And the hospital-acquired conditions is also a penalty avoidance program as well. Secondly, under this Medicare, you have bundled payments opportunities where you can volunteer to participate in certain episodes. An example of that would be BPCI-A, the Bundled Payments for Care Improvement Program. And then finally, you do have the shared savings opportunities in programs such as the Medicare Shared Savings Program. You also have opportunities in value-based programs under what's called hospital efficiency improvement programs. Now in this case, you have the physicians and the post-acute providers who themselves combine together to collaborate with the hospital, as the hospital is actually the payer in this case, attempting to reduce cost in key critical areas for Medicare and Medicaid patients. So do your homework, prepare yourself, and if you carefully develop your strategy, you can succeed in this area and you can be successful in receiving additional value-based reimbursement. Well, that's it for this episode on achieving value-based payments, a sequential approach to risk versus reward. Hey, let me know what you think on this episode by commenting in the comment section below. And if you enjoyed this video, share it with other providers who might need some help. And give me a thumbs up below. This really helps to share this video with others who might need it. And of course, if you like this educational approach model, or you have any questions, or you might need my help in trying to figure out how you can cut through the BS of these value-based reimbursement models, give me a call on my cell phone at 615-335-0503, or you can email me at mm.healthstrategies@outlook.com.